and welcome to Health Matters on Channels Television. It's great to be with you again. I am Mary Alale Yusuf. According to the DG of the World Health Organization, hearing loss has often been referred to as invisible disability, not just because of the lack of visible symptoms, but because it has been stigmatized in communities and ignored by policymakers. Globally, over 80% of ear and hearing care needs are not met. Over 5% of the world's population, or 430 million people, require rehabilitation to address their disabling hearing loss, including 34 million children. That figure is projected to rise to almost 2.5 billion people with some degree of hearing loss by 2050 and over 700 million needing hearing rehabilitation. The apex health body, WHO, says deeply ingrained societal misperceptions and stigmatizing mindsets are important limiting factors to preventing hearing loss and to give hearing care. My guest is Professor of Otorhinolaryngology at the University College of Health Sciences, University of Abuja. He's also an ear, nose and throat surgeon at the Abuja University Teaching Hospital, president of the Foundation for the Sick, and a health policy and management specialist. Professor Titus Ibekwe is right here in Lagos with us. You're welcome to the show. And it's great to see you in living color.
Yes, it has always been from Abuja. Thank you.
So, what factors contribute to hearing loss? Let's start from there.
Yeah. Actually, your intro was very rich because beyond what you have said, it's also seen as a silent handicap. Because you see somebody who has hearing loss walking towards you, you wouldn't know until you engage in conversation. But it could be congenital or acquired, which means it could happen during the course of formation of the baby while still in the womb or during the course of delivery. Or it can happen after a baby has been fully delivered, due to environmental factors and others. So the congenital ones commonly will think of stuff like genetic. So those who said it could run in the family, they are correct. To some certain degrees, some of the hearing losses, are tied to certain genes. Most of them are, what we call recessive genes, which is when two individuals that have such genes only got married that they'll be able to give birth to a child that has, will develop hearing loss. While an insignificant percentage is dominant gene. So in as much as one of the partners, whether it's the male or the female, has, definitely any of their children will develop hearing loss,
So it's more often a recessive gene in two people?
Most of the time, yeah. So a typical example, which has been portrayed in our recent findings, is sickle cell gene. A lot of people wouldn't know that it predisposes to sensorineural hearing loss. So those who carry sickle cell anemia, significant percentage of them in life would develop sensorineural hearing loss. So
this is a new discovery?
Yes. That's about genetic. Then we'll talk of, ototoxicity. That's why during pregnancy, we seriously advise that pregnant mothers should not engage in taking any self-medication or the one that's not, prescribed by experts. Because certain drugs has the capability of knocking off the hearing organ of the developing baby in the womb. So, and a lot of concussions have been tied to this because most of the time you wouldn't know actually the constituents that is within those concussions. So some of the elements there are capable of causing hearing loss. Then certain infections that pregnant women, get exposed to during the course of,
their pregnancy.
Yeah, their pregnancy can lead to this. Very common ones, group of infections that we call the touch infections. Toxoplasmosis, rubella.
Rubella?
Yeah, rubella is part of it.
Rubella has an immunization.
Yes, that is where I'm going to now. That is why we talk of the need for antenatal, because once they are immunized during good antenatal care,
that knocks off that whole set.
Knocks off those whole sets. They're protected. Then during the course of delivery on its own, if the baby is too big for the birth canal of the woman, what you will get is an obstructive, labor, which means the head of the baby and part of the body will get arrested in the birth canal.
In the birth canal, yes.
And once this stays for a long time, the baby will get suffocated. And the brain and the organ for hearing in these children, very fragile. So asphyxia for just a short moment, up to 4 minutes, can knock off that organ of hearing.
But doctors are trained to know when it's time to make the call for a cesarean section, right?
Right. That is part of the antenatal care.
So it's the patients that are just always messing up the thing.
Well,
saying, no, I must have my baby normally. And they don't know about all these complications that come with it.
Is what I say, just like tempting God.
Yes,
because
it's not
God
their
has
portion and all that.
given men this knowledge to take the rightful decision. By no means is any child delivered through vagina superior to a child that is delivered
not at all. Not at all.
It's not the same. Sometimes you may be surprised. The one delivered through CS may even be a lot healthier. Then immediately after delivery, certain activities can happen. Jaundice, which is something that is very common.
Which is something that the doctor always looks out for.
Yes. So those jaundice, there are classes and there are telltale signs. There are this type of jaundice that you see. This is a dangerous type of jaundice. They say, no, ma'am, you can't go home with your child. So we try to expose them to light, to sunlight, and UV light and all this to help in dissolving, the bilirubin, which is the chemical responsible, the constituents within the system that causes that jaundice. It becomes water soluble, and the children will pass it freely and safely.
And their ears will be safe.
They will safe, and their brain. But whereas this is not done, there is tendency that they also develop this hearing loss. And then after delivery, what next? The environment and what you do with your child. So the child deserves to have the childhood immunization also.
Yes.
Because stuff like measles, the same rubella, etc., and some other infections.
I hear meningitis too.
Meningitis, you're right. So all these are capable of leading to hearing loss.
Lassa fever.
Lassa fever is also there, both for children and adults. Whereas once vaccination is given for those that are vaccine preventable, and even now a lot of effort has gone into development of vaccine for Lassa, and I'm sure very soon it will be out. IRWA, which is the Center of Excellence, I happen to be a member of the board, for the Lassa fever. So a lot of effort with external collaborators, almost getting there. So all these immunization, they are safe. They've been tested before, being pushed into the market. People should not have the misconception of not allowing their children to have this. Okay, you step out from that, then the common infections of the ear. You see, you go to the hinterlands, what is usually common is children draining from the ear, pus flowing from the ear.
Why would that happen?
Yeah, so that's what we call otitis media. Suppurative otitis media. It could be acute, it could be chronic, and sometimes otitis media with a fusion. The environment we're living in is not completely sterile. So sometimes from what you inhale, from the level of hygiene, the level of even nutrition, when the nutrition status is very low.
Okay.
So the children mainly get predisposed to some of these infections that ordinarily their body would have been able to handle. And certain practices, some people, they keep inserting things in the ear, hoping to be cleaning the ear, even cotton bud. Whereas in the process, you're introducing infection, or you can traumatize the eardrum or the canal, thereby exposing these to infection, because the air we breathe is not sterile. You analyze it, you see a lot of microorganisms within there. But our body has been prepared in such a way that it will be able to, manage and encounter and fight for us when it is very much needed. So when any of these bridges, have been broken, then the consequence is falling on the other side of having this infection.
So many causes, and we haven't even mentioned noise.
That is another huge area where today both children, adolescents, adults, especially adolescents,
they have
to
their
them
music
is very
on the highest level.
Thank you.
And
wearing
inside
their
the ear.
earpiece, especially the one they call the earpiece, the tiny one, because the earphone is a lot safer. It doesn't completely occlude the canal as does the earpiece. The earpiece will occlude the entire canal, channel the entire sound, everything, the frequency as it were, directly into the ear. And when this is engaged for a long time, it's capable of leading to noise-induced hearing loss. And this is very dangerous because I can tell you that it doesn't have cure. I mean, noise-induced hearing loss.
That is irretrievable.
Yeah, it's type of sensory hearing loss. All that you can do is, some level of rehabilitation, giving some, hearing assistive devices that will help this person.
Okay,
Then
at this
aging
point,
is also very important. Age, because we're all getting older.
Okay.
As one is getting older, you have what we call presbyacusis, because every organ in the body gradually will be shutting down, including the organ for hearing and balance.
Yes.
So that is.
But some people are old and still hear very well.
Absolutely right. The level of genetic programming varies from individual to individual, and even longevity tend to run in some families. And again, the type of quality life that you led when you were young is going to reflect.
Age, there are so many causes of deafness. We've been going on and on. But one thing I know is that most people understand that their aging loved ones are not hearing as well as they used to. They're used to it. And because of that, maybe they talk louder or whatever to them so that they can hear. So where is this discrimination and this stigma that WHO is talking about coming from? I mean, it's not like we're not used to people, losing their hearing. How does it? What does this stigma look like?
Well, it varies, and actually, but one thing is that, the family support system in Africa is very, very helpful. So that irrespective of the type of condition you find any of your loved ones, people will still rally around.
Yes.
So that communal system help in propping up. But in a lot of climes where this is not happening, is frustrating to the younger ones and staying around the elderly ones, for instance, whom you have to repeat words over and over for them to comprehend. So it's not everybody that can tolerate this. But beyond that, superstition plays some role, especially in our hinterlands, due to, impoverished knowledge. Some people believe that hearing loss is curses coming from gods. Maybe it's true.
It sounds so ridiculous.
And others believe that certain family, due to some of the atrocities they committed in the past,
that they're being punished.
Yes, being punished, and it runs in their family, and you dare not go to marry from there and stuff like that.
Wow.
So all these things are real. And
because of that, people will not seek help.
Absolutely.
That's where I'm really going to.
Yeah.
How often do people even go out and seek help for hearing loss? Do they even realize they're losing the hearing? It's another thing.
You see, that's why this hearing loss described as, a silent handicap. Because even in families, they will tend to take people who are running fever or somebody who has obvious wound that they can easily see, or even somebody who is blind that, he's blind, they can't see, they tend to present such people earlier in the hospital compared to somebody who is hard to hearing. Sometimes you see parents even beating their children, saying that this child is very obstinate. You give instruction, he does otherwise, not knowing that the child is not hearing well.
Does this really happen?
It does. And the same
thing...
Don't
they check a child at birth for his hearing capability?
That is the problem, because the recommendation globally and World Health Organization is that every child delivered must be screened for hearing before leaving the hospital.
Is this part of the APCA score?
No, APGAR score is pretty different.
It doesn't include hearing.
No. APGAR score is immediately after delivery. So you check certain, parameters in the child to know how alive this child is, or how down, unconscious this child, the level of consciousness, just put it that way, immediately after delivery. That's APGAR score. It has nothing to do with this hearing screening for newborn.
So at what point do they check a child for?
Immediately after delivery. It's supposed to be checked within the first 1 week. Before the child is discharged from the hospital, that's supposed to be checked. As a matter of fact, Mary, in 2008, I was one of those that led or championed the cause for, establishing the policy for hearing and ear care in Nigeria. It took a lot of effort. We brought in, organizations from outside the country, partners, co-funders, and all those. And the will of the Ministry of Health and the then Minister of Health, Professor Isaac Adewale, saw it through. So it was done. And we came up with a 5-year strategic plan. But the problem is implementation.
So right now as we speak, are some children still being sent home, some babies, infants still being sent home without this test?
Plenty. Because all you need is a simple machine that we call autoacoustic emission machine. Once it's available, and it is a non-invasive test, which means there's no harm that has been attributed to
there's
that.
No puncture.
At all. No puncture, no pain. So all you do is just like something like an earpiece. You put it inside the child's ear, switch on the machine. It has the ability to pick up some sensitive electrical signals, which a living cochlea, which is the organ for hearing in the ear, emits all the time.
I'll have to pause you there. We need to go on a break right now. We're going on a short break. Please stay with us. Meet us on the other side. Welcome back. It's Health Matters on Channels Television. We're talking about hearing and ear care. 0808-054-2233 is the number you can call if you have questions. You can also tweet, send a message on X at CTV_Mary A, and send me email, moalale@channelstv.com, while we continue this very interesting discussion. It seems to me, from what we've been saying, from looking at a child who isn't checked for his hearing before he leaves the hospital, and perhaps at other times may not even know he has a problem.
Absolutely.
Everybody can identify that the child is not seeing well, or is not walking well, or is not eating well, but may not know he's not hearing well. So we probably have a lot of children shortchanged by the system. How many hearing tests do you think should a child have before he now comes into consciousness to be checking such things for himself or herself?
You just raised a very conscious, question now, which I would say is very critical, because even beyond the hearing of a child, is like a switch in the development of what we refer to as, the children's intelligibility.
Okay.
All put together.
Cognitive
function of a child. So it's only when a child hears within this stipulated period, and 2 years is the golden period. The first year is the best period in life. So when a child hears environmental sound within this period, the complex network will go and switch on the system. And this also switches on the system of speech.
Wow. Okay.
So that's why
a hearing impaired child is also a speech impaired child.
Yeah, speech impaired. But they almost always go together. And recently we found out that the same cognitive function also has connection with sight. connection with the level of intelligibility of the child, the knowledge, because all the neurons that process all this get switched on within that period. And all these things put together that made, the authorities worldwide say that every child must be screened, immediately after delivery, at least within the first 2 years of life, better still within the first year of life. So we're advocating that if you miss this child out during that first week while in the hospital, when the child is being brought in for the first immunization, this hearing screening should be tied to it. So you screen. Second immunization is another opportunity to screen. Before a child starts pre-nursery school, the child's hearing must be screened.
Let me pause you for a minute and take this call from Ikechukwu in Aba. Hello, Ikechukwu. What's your question?
Yes, my question borders on blocked ears. Sometimes my ears are blocked. Sometimes when I apply ear drops, it opens up. So I don't know what actually could be the problem.
Okay, I will address that to the specialist here. So what is Ikechukwu talking about? Blocked ear, and then he uses eardrops. By the way, can somebody use over-the-counter eardrops? That's just a thought.
Well, we discourage all this because, recall, we say that the problem is that you wouldn't actually know the content. And there is no one-stop gap for all. What works for Mr. A may not work for Mr. B. And what works with a particular diagnosis that present with similar symptoms may not be universal. But from what the picture he's painting, seems he has impacted wax.
Okay.
All right. So, because in such situations, when the wax have accumulated over time is blocking the ear, you won't be able to hear. But when he uses those drops, it will soften them, they will give way, some sound will start passing by and he'll be hearing.
Okay.
It gets dried up again, swells, falls into place and closes.
Okay.
The simple advice is that he should go and see his ENT surgeon. It may be something that within 10 minutes they'll get resolved.
Okay. Yeah. So following through from this, can you give us some tips on how to prevent hearing loss generally for everybody at home now? Okay.
Well, starting from our children, which is very, very important. So there is need, even from day one, that couples are coming together. Okay, so they should know what they're going into, and we don't usually advise two people that have hearing impairment getting married, because there's tendency of this genetic thing that we talked about.
Pass it on to the children.
Yes, pass it on to the children. That's one. Then two, once a mother takes in, it needs all the antenatal care to prevent.
She should take all her immunizations.
Yes, and keep to all the appointments as have been scheduled by their gynecologists or generalists that are seeing them, to make sure that the chances of this baby having congenital hearing loss as much as possible is reduced to the barest minimum. Where they take their delivery is also important. Delivery is taken at least in a standard maternity, where the person there is trained and will be able to detect when things are going wrong. And if you are advised, please, let's go for cesarean section. And there's no stigmatization here. There is no death sentence here. There's nothing. You stand to gain all. Please subject yourself to it. And even after delivery, the child has to be well examined, and the hearing of this child should be screened before the child leaves the hospital.
Okay, so we have to close the show now, but I will also put in something that you have taught me from time and again. Please avoid noisy places.
Absolutely.
Because that can reduce your hearing.
Yes.
Thank you so much for coming on the show, Prof. And it's wonderful to see you in person once again. Thank you for being with us there. Thank you, Ikechukwu, for your call. I hope your question was properly answered. Have a great day, everybody. I am Mary Alale Yusuf.